Hi, everybody. I am Dr. Audrey Wells, and I'm the owner of Super Sleep MD, which is a company that helps people with sleep apnea get fully treated without sacrificing their comfort. And one of the big pain points is the CPAP mask. Now, CPAP is the gold standard for sleep apnea therapy. And I want to introduce you to the three different types of masks, and then I'm going to show you some examples. Now, behind me are the heads of all of my ex-husbands, which are kindly now supporting my sampling of masks. So in general, there are three different types of mask. There's a nasal mask, which goes over the nose, usually covers the perimeter around the nose. Then there's a nasal pillow mask, which usually fits up to the nostrils, and there's a piece that fits just inside the rim of the nostrils, doesn't go in too far. There's within that group is a nasal cradle mask, which also goes up to the nose, but there's no piece that sort of seals against the nostril. So nasal pillow, nasal mask. And then the third type is a full face mask. Now, this is a mask that's going to cover the nose and mouth, or go up to the nose and cover the mouth. So the important thing about a full face mask is that the mouth is contained within the mask, which means that if a person is a mouth breather, the CPAP pressurized air is going to go in through the mouth and support the airway, which is the therapy, okay? Now, if you are using a nasal mask or a nasal pillow mask, the air pressure goes in through the nasal cavity, and the idea is it goes through the back of the throat to support the airway. But of course, if you have your mouth open with a nasal mask in place, that air pressure can just take the path of least resistance and go right out the mouth. So that's a problem because you want the air pressure delivered to that floppy airway for effect. So a person using a nasal mask or a nasal pillow or cradle mask absolutely needs to have their mouth closed throughout the entire period that their CPAP mask is in place. Otherwise, they're not getting therapy. And more than likely, they are not feeling too comfortable because they'll wake up with a dry mouth. So I want to show you a few different types of masks. I'm going to start with a nasal pillow mask. So you can see this one here. As I mentioned, there are pillows that go right up to the nostrils, and you can see how the pillow is meant to fit inside the perimeter of the nostril, and then the air pressure is delivered this way. We have a flexible tube. This one has a hinge on it, so it can go in different directions. And then the exhalation port, which is where the CO2 is released, goes out these little holes that are mitered into the mask itself. The nasal pillow and the nasal cradle masks are typically very slim, so less plastic on your face. People usually like that. You can see here that this particular mask has a relatively sleek headgear. Next, I'm going to show you a nasal mask. Here we go. So this is a nasal mask, and you can see how it fits around the perimeter of the nose. The pressure or the firmness of that seal should be like a kiss from your lover, okay? Not from your grandma, just a firm kiss from your lover. It's going to make that seal by adhering to the skin and allowing that air to be conducted into the nasal cavity. With this mask, you don't get a very big tube coming out. This is quite small, and this one has a quick connect. So if a person wants to get up and go to the bathroom in the middle of the night, they can do a quick disconnect and then put it back in place when they get into bed. So you can see the headgear is a little bit different configuration, and each brand has a different sort of way that they do the straps. A lot of these masks come with magnets on the side, which I really like because it's very fast to get out of the mask. But there are some restrictions with the magnets and different health appliances like pacemakers and such that you need to be careful with. Third type of mask is the full face mask, and I'm going to show you the two different types. So you're going to see first the one that goes over the nose and keeps the mouth inside. That's this one here. So you can see how this rides up further on the face, which is important to realize, because people who like to read in bed are not going to be able to put their glasses on with this mask. However, active sleepers do better with this type of mask because there's more surface area, which tends to increase the stability of the seal. So this is a traditional full face mask. And this is a different type of full face mask, sometimes called a oronasal mask or hybrid mask. Now you've got the nasal piece coming up to the nose here instead of going over the nose. And so you would be able to wear glasses with this type of mask. And then you can see the mouth inside, which is good for people who absolutely cannot breathe through their nose. However, I always like to push nasal breathing as much as possible because there are so many benefits, not the least of which is that compliance or adherence to CPAP treatment is better when people are able to use a nasal mask or nasal pillow mask. So the full face mask is better for higher pressure sometimes or for nasal congestion. However, with these, the compliance tends to be a little bit lower. This one, I want to point out, has a different headgear configuration. The tubing comes out on top. So if a person is rolling in bed, they are not upsetting that tubing. They're not having so much floppiness with that. And with this particular design, you've got the air coming through these flexible tubes on the side to be delivered to the mask. So the air is flowing here. If you're laying on your side, most of the air is going to come up through this way. And this is a pretty popular one, but you do get some hair breakage here, which is why I have this little cloth barrier on my dummy. All right, guys. Those are the three different types of CPAP masks that you can get. And within each type, they have some different features. There are different brands of masks as well. Some of the popular or bigger brands are Philips Respironics, ResMed, Fisher and Paykel, and React or 3B. Those are the major CPAP brands. And all of the masks are interchangeable with the tubing and different machines. So it really doesn't matter too much what the patient chooses, but they should choose something that they are going to be able to wear night after night and hopefully throughout the entire sleep period, not just the first 4 hours. Now, if you have patients that are wanting help with their CPAP treatment, if they have internal resistance or problems finding a mask that works for them, I can help with that. That's what I do. That's my passion. That is my joy. I'm at supersleepmd.com. I host group coaching sessions. I have online courses, and I've got a ton of free material that's meant to be helpful for people who are trying to get better sleep. Thanks so much for listening. I hope it was helpful.